any pain. This is specifically for this exact purpose. Someone who's coming in saying, hey, got this gnarly stuff going on, and you don't want to maybe bust up your thumbs doing it or use a tool. There are a lot of people that come in and say, my doctor gave me ibuprofen or gave me something for my knee to take, and I'm icing, and my knee hurts on the inner side, and I'm training for a marathon. And my thought is, okay, the anti-inflams are bad, not necessarily bad. They're not optimal because you're not getting inflammatory healing to the muscle. We need that. You're training for a marathon. You're doing 16, 17 miles at a time. So my whole theory is get this unbound. We watch the video. You can understand how important that is. So all I'm going to do is do pushing the same way, and he's just going to basically breathe deep and get to a different place in his body, and we're going to go 30 seconds, okay? Just 30 seconds.
You stick in your office, put between their teeth and
This is what you did to my back.
Yep.
Wow.
You're doing
30
like
seconds,
a
Jim.
fist
Just
swing.
I
breathe.
feel like you need like a hand to hold or something. I would.
15,
Oh my God.
Oh,
Except with you, he was
too.
using his fingers.
7,
ooh,
3,
he's like actually gripping my
2,
hand.
Oh, I
One.
bet he is. It's not very enjoyable.
That's what you're.
That's what we all
It's
felt.
okay
this
to
spot
cry.
right here, that was.
You can
was
do
that
it.
Feel
because you were-
adhesion. Yeah, you guys can feel it. It's huge.
Ew.
So this whole thing is bound up, not just that little area.
It's huge.
We've got something here. So these muscles, you should be able to actually pick them up
you feel
separately.
Dang.
But it's
That was painful.
it's going to be harder there.
Yeah.
That's what I was gonna
Oh my
buy.
gosh,
What is that from an injury?
that is really.
Yeah.
So what I would do is I would actually keep doing this all along this edge, or I would tell him next time you come in, I want you to shave your upper leg and we're gonna cup.
How do you know when to stop doing that?
I'm tuned into what he's going through. I don't want to put him through too much.
Okay.
Obviously, this is part of our session, so I would have been like, this is what he's coming in for.
Right.
He's not coming in to walk out like an angel. He's gonna be beat up.
He's gonna be beat up.
So
It feels good.
we kind of go like I'll go 30 seconds. I might only do this, and then I'm going to do something else to kind of flush it away. I'm going to get something else moving. I've learned over time that if you do something like this, you should finish with something that feels really good. Like I've had people absolutely
Yeah,
say,
thank
"Hey, do you think we could do something really cool? Because man, this sucks."
It's like watching a scary movie before bed and then having to watch like
Would you-
cartoons first before you sleep.
This is just intuitive on me. Would you? I mean, I think I would feel like compression would feel good, but that's not what you would want to do, though, would you?
You
Or-
could do compression. I just don't know
Even though
that it's gonna
push
break
it
up
back.
the fascial sheath the way we want to between the muscles and get that adhesion. The other thing that we could do here is while we're pushing that I like to do.
Oh.
Yeah, because I can feel it all the way down in my shin.
So what we're doing is we're applying flexion. Well, now we've shortened things. We're applying flexion with pressure and pushing to make that fascia open up where I'm flexing as I'm pushing.
Let me see.
So we're adding those two things on, and we'll get more into this when we do rotating stretching. But
Looks like rope burn.
so that's pushing on the adductor, and it's the easiest. I could show pushing on the abductor and the IT band side. It's just much more difficult to do, and I rarely do it. There's other things you can do for that. Just because of the angle, this is much better to get to. And for a lot of athletes, if you work with athletes or people with a lot of leg and hip pain, this is a really good one to do if you're at that stage of your therapeutic relationship.
Would you say that spot right there is more red than here because there's more of
Yes, that's where the
that's where it's at?
that's where the stuff's at, or at least part of it. There's
big-
more too that I could have pinpointed right here at a different direction.
Sure, okay.
But that's what he gets for now.
There's a lot in there.
So now go side lying if you would, please. Move down the table just like 2 inches.
Towards you?
Nope, the other way. Thanks. Okay.
Oh, that's a pretty nifty way to do that.
Can you pull your shirt up? Or is it okay if I do that? Just like this is fine. Yep, that's fine. And then your hand over your head like this. So if I take his hand, I want you to watch everything bend here. Everything start to come up at a certain point. See how he's really working? He can't access. This is hard for him to access. I want you to push this forearm towards me. See all this come out? We're bound up here big time. Okay? So what I would do as well, pushing, is shorten everything. And as I push, I stretch. And this is a pushing that I've just recently come across. I wanted to share because it's
I feel like that
very
would really be
applicable.
hurting my sternum.
Your sternum?
Yes.
Ribs?
Like to lay on the side and then when you push, I feel like it would be crunching my sternum.
So you could do that way, and we'll see what difference already you see.
Oh, wow.
That was big, huge. Do that one more time, really slow.
You want me to push against you?
Nope, I want you to just be dead weight.
Oh, wow.
Pretty awesome. So we could also do, maybe we'll put this just right here. Is that comfortable for you?
Yeah, it's fine.
Okay. What we could also do is the same thing.
Come around here.
A little bit of oil, either, I would probably come this way, and I could go pushing along the lat with my fingers,
Is it good or bad? Good.
my thumb, my forearm. And if I was going to do stuff like this, and normally I have an idea in my mind if this is needed, for a female, I would just say, hey, can you come in with workout gear on? Maybe a sports bra or something like that, where we could pull up the shirt and maybe tuck it in. And I'm very vocal. I'm like, do you feel safe? Is everything cool? Do you feel like this is good that we can work like this? You could also bring in a towel, and I've done this too, a sports bra and a towel, just to make sure that we're good. You feel good about this, I feel good about this, so that I have a lot more freedom to work, and I'm not in the back of my mind thinking like, what is she thinking? Is this bad? Does she feel unsafe? Because that's not what this is about. So this area for a lot of people gets bound up too, because think about a computer. Put your hands in front of you. This is back, we're down. So we're locked up here, right? We're locked up here. Yeah, this gets bound. So accessing this position is important. You're reaching over your head to get a can of Campbell's, and this is tight. You have back pain. You have a lot of things going on. So to be able to do stuff like this and just think about it is important. That's really what I guess I'm doing this for. So you start thinking like, wow, there's just tons of things you can do in tons of different places. And you could go, in this case, against the big hill. So we're going up the hill. And I know the scapula is right here, so I'm going to go along that border of the scapula as well. Okay? So pushing along the lat, side lying. And we're not going to probably do this one today, but I wanted to just show it to you so you could practice that at home if you wanted to. Cool. So I think we're good. Part pushing on the forehead. Will you just lay back on your back, supine, for a second there, Jim? I'll show this real quick.
Is this good for headache?
It's certain types, and maybe at the very acute stages. Yeah. You're gonna start. Right.
Sorry, what is this called again?
Part pushing on the forehead.
Okay.
You're gonna push down on top of the eyebrows.
Are you squeezing with your fingers down
Nope.
here?
Okay, I'm gonna come down. I'm gonna knead a couple of times on Taiyang. Come down to a point right here at the junction of the bone's escaping me.
Zygomatic?
Yes, zygomatic arch. Thank you.
Zygomatic.
And then down along the masseter to stomach 6, which I'll show you, and then come down back of the head. Dr. Joe will actually pull the hair, and then you come back up a little bit and do the exact same thing until you've done
That's awesome.
down here, This would be your last pass.
Over stomach, right
Hmm?
there.
Yep, the stomach 7 is in the zygomatic arch right here, and stomach 6. So clenchers, which Jim may or may not be, but it sure feels like he is.
My
Like when you
stomach's a
clench
mess.
your jaw like this. is
Or
that
his
what you mean?
stomach's a mess, he said. Yeah, when you're
Oh.
clenching and sleeping. Or you have TMJ, really good for TMJ.
Oh, what else?
Stomach 6 right here, especially the right side. Dang, buddy. You all right? Is that too much? Okay. And then we'll go down to that stomach 6, which is if everybody clenches their jaw and puts their thumb at the hiatus of that clench. That's stomach 6. Now
Mhm.
relax, that's stomach 6. So you can press that point anytime your jaw hurts, it'll really help. Then I come down behind it and behind the ear. Part pushing on the forehead. And then, like I said, part pushing, you could also clavicularly part push like this. Over the clothes or not. This is really good to help break up some of this pectoral adhesions here. Good for there's a kidney meridian up here, large intestine. So, lots of stuff.
Cool.